It's 5 p.m. here in Seoul. Thanks for joining us on Arirang News. I'm Devin Whiting. We start this afternoon with a live briefing from the South Korean health authorities. That should start any moment now. We're expecting an announcement related to the country's vaccine campaign, and that campaign is gathering pace. So far, the country has administered almost 3.4 million total first doses, as well as 236,000 second doses. Yesterday, the doses given out were about 1,500, so they are not quite up to the speed they are during the week, over the weekends, but they are occurring, and the country aims to achieve 70% of the population vaccinated by November this year. That could actually occur earlier. The government has said as soon as September, if they do get the vaccines into the country as scheduled. South Korea has secured deals for millions, many millions more doses than would be needed to achieve herd immunity. We could be getting an update on those shipments and those deals or other aspects of the vaccine campaign. President Moon today did say that South Korea should expect to get the vaccines in according to schedule and will not experience a shortage of vaccines. He was saying that over concerns that the country may end up falling behind on its vaccination schedule, reassuring people that that will not happen. And as we expect an official to come up to the lectern there any moment now, it looks like reporters are getting ready. South Korea today did actually see a decline in new cases of COVID-19, fewer than 600 today, so they may address that issue as well. Let's listen in.
실무 배석자는 이후 설명드리겠습니다.
We have also sign language translation available for this briefing today. First of all, we have Chung Eun-young, Commissioner of the KDCA, who will be briefing on the COVID-19 response as well as vaccination plans. I am Commissioner of the KDCA. First of all, here are some plans for us to stabilize the COVID-19 outbreak as well as our vaccination plans after May. Here in South Korea, the outbreak, which has also seen its third outbreak in November, which has peaked in December, and we also seen lately another surge in the number of daily new cases. However, this week we are seeing a decline, and lately we have seen cluster infections centering around the metropolitan area. However, this has also spread to non-metropolitan areas, including the Gyeongnam region. And in recent days, we also have seen a slight increase in the cluster infections and infections among nursing hospitals and long-term care centers. We are also seeing new cases at restaurants, churches, and also public saunas. And the risk factors are as follows. First, we are also seeing a prolonged COVID-19 outbreak, and this is leading to an increase of the level of fatigue, and also many hidden cases are also hidden across our country. And there are also many public use facilities that spread the virus, as well as the influx of new variants as well. And considering all of these aforementioned conditions, in order to contain the COVID-19 virus, as mentioned in April, we will be continuing to put forth our plans as devised earlier. And marking May, which is the month of family, we are also going to intensify our monitoring for the new variants, and also especially look at the families also in order to prevent any cluster infections stemming from family members. And the outbreaks, in line with these outbreaks, we will also intensify our capacity to test the COVID-19 patients, and centering around cluster infections, especially the facilities that are prone to cluster infections, including those involving many senior citizens and women cluster women groups. We will also intensify our PCR testings and massive preemptive testing as well. And also in order to enable more facilitated testings, we also have expanded the number of testing sites at the public community welfare centers and health centers, where people will be able to receive the COVID-19 testing for free of charge. We are also asking the doctors and also pharmacies to recommend people to get tested if they have any clinical symptoms of COVID-19. And we will also provide detailed guidelines. And we also have the detailed plans for utilization of the COVID-19 self-test kits. We are also providing administering that is antivirus treatment among the patients. And also the new variant is also posing a great threat to the country. And as for all of the people returning from South Africa and Tanzania, we are mandating them to be isolated at designated facilities. And all of these people, as for Korean nationals, even though they have been fully inoculated, if they are flying in from South Africa and Tanzania, we will also have them under mandatory 14-day of quarantine. And as for India, all of the people who are flying into India, we are also mandating them to have flights capacity about 60%. And all of the inbound travelers from India, regardless of their nationality, they are also mandated to go under self-quarantine, and they are also going to be tested with PCR testings. And going forward, we will also look into other countries that are having higher risks of the new variants. We will be providing detailed guidelines for quarantine, and this will also expand the PCR testings to their immediate contacts and also then forth. And at Ulsan City, which is also seeing a large increase of the new variants, we are also expanding the number of testing sites, and we are also issuing the administrative order to recommend all of the people who have clinical symptoms to get tested if they have been recommended by doctors or pharmacists. And aside from this, marking May, which is the month of families, we are also going to provide the public campaign for quarantine measures. And if it's necessary to have a group meeting within family members, we ask you to meet outdoors rather than indoors. Also, you need to always wear face mask and keep abiding by the quarantine measures at all times. Lately, we are also seeing many considerations of these vaccine inoculation plan, and here are some details. The government is also providing and focused on using the vaccination doses in a most efficient manner, and we are also seeking ways to expand the inoculation rollout to as many citizens as possible. And right now, we have Pfizer vaccines. We have more than. We also have about 5 million doses to be arriving here in South Korea after May on a weekly basis, and they will be rolled out to senior citizens above the age of 75 for first and second dose inoculations. And by end of April, at vaccination centers, they have been focused on the first vaccine rollout. However, as for the people who have been inoculated with their first dose, about 1.34 million, that is, they will be given the second dose of the Pfizer vaccines. And when our second dose inoculation is stable and is carried out in full-fledged, we will also be focusing reshifting our focus back to the first dose inoculation. And as the AstraZeneca vaccines, we have a total of 2 million vaccines that have arrived here in Korea. And also starting from May and also in June, we also have more consecutive COVID-19 vaccinations of AstraZeneca's vaccines to arrive as well. And we also have 1.64 million from COVAX facility, and about 8.9 million doses of the AstraZeneca's vaccines will arrive going forward until August, that is. And we will also roll out the vaccines in a timely manner to the people. And here are our inoculation rollout plan. And the government has also rolled out its plan to inoculate the Q2 recipients. And we are also considering and reflecting the changes of the outbreak. And after May, we have been devising our detailed plans. First of all, the Q2 eligible recipients were originally around the senior citizens of 65 to 74. However, they have been expanded to include about 8 million senior citizens. And this considers the fact that the fatality rate of COVID-19 is higher, especially those above the age of 60. And our goal is to aim for 12 million inoculations by first half of the year. And we will also aim higher to achieve about 13 million by the first half of this year. And as for the people, the analysis for the people who have already been inoculated, we see that 86%, more than 86% effectiveness have been proven after a certain time after their inoculations. And after inoculation, the people aged over the age of 60, they only have about 0.9% adverse responses, and most of the severe cases as well as death were related to underlying illnesses as well. And we have no new cases of blood clots reported among these senior citizens. And we also have looked at the citizens, about 8 million citizens, senior citizens, and we will be administering them with the AstraZeneca vaccines. And also in a weekly basis, we will also have the different age groups of the senior citizens, and they will be available to have their bookings for the COVID-19 vaccines. And we will be rolling out the vaccine rollout at the designated hospitals nationwide. And as for the teachers at primary schools and pre-K, as well as kindergarten and chronic illnesses, patients with chronic respiratory diseases, we will also give them the AstraZeneca vaccines. And as for the eligible recipients, those exempted from the AstraZeneca vaccines are below the age of 30, and they are about 1.9 million, and also they will be given the Pfizer vaccines instead. And also about 450,000 service members in the Army who are below the age of 30, they will be given the Pfizer vaccines. And by the end of June, we have aimed to reach 12 million inoculations, and we are sure that we can achieve this. And we will also exert our full efforts to have 13 million to be achieved by June. And we will also achieve the herd immunity by November. And the KDCA would also like to exert our full efforts to have the online reservations for the COVID-19 vaccines to facilitate efficient bookings of vaccination rollouts. We also have the call centers for the vaccine reservations for senior citizens, and they will also be assisted by the public health community as well. And we are also working to design a smartphone application where we could also utilize this to easily book the COVID-19 vaccine inoculations. And the quarantine authorities will also exert full efforts to enhance the efficiency and the accessibility of the vaccines going forward. We will also establish more vaccination centers going forward as well. And starting from July, we also schedule the Pfizer vaccines to be given out at designated hospitals as well. And we will also be fully equipping these hospitals to provide the Pfizer vaccines to the people. And we will also enhance our capacity going forward. And by September, we will also make sure that all of the people who are willing to get vaccinated will get their first dose. And we will also aim to reach 36 million inoculations by September. Thank you very much. And next we have Minister Chun Hae-chul, who will be providing us on the details of the assistance given to the local authorities in terms of vaccine inoculations.
In
the first half of this year, we aimed to achieve more than 12 million inoculations, and we will be providing more assistance. And now we are aiming a higher goal, and we are aiming to reach 13 million inoculations by the first half of this year. I am Chun Hae-chul, and I would like to first of all extend my deepest appreciation to all of the public, the members of the public that is, who are exerting their full efforts to fight against the COVID-19 outbreak. And to this end, the government will also continue to exert our full efforts to help the citizens return to a state of normalcy, as well as to enable the efficient rollout of the vaccines. And we have been aiming by July to increase the vaccination centers to 257. However, this has been speeded up to April, and we have already set up 257 vaccination centers. We are also speeding up a vaccination rate as well. And there are also many people working at the public health centers who are facing a high level of fatigue as well as a workload due to vaccinations. And we are also mobilizing more public servants to help out with their works. And as for the citizens over the age of 75, we also have these public servants who are visiting their homes to help them with the booking of the inoculations, and they are also helping out with the prescriptions as well. And thanks to their help, we have been able to provide the vaccines. And thanks to the application, we also have the National Secretary Service, which is also being utilized by over 90% of the people who have been inoculated. And our ministry will also exert our full efforts to assist the citizens going forward to enable the sufficient rollout of vaccines to achieve 13 million inoculations by the first half of this year. And starting from early May, we will establish new 20 vaccination centers here in Korea. And we will also enhance and upgrade the capacity of the vaccination centers, which amounts to 257. We will also mobilize more doctors, and we will also hire more doctors when they are necessary. Moreover, at all of the 17 major cities and provinces, we will be visiting all of these cities and provinces. We will be listening to the opinions on the field to have any administrations adjusted if needed. And second, we will also make sure to mobilize any of the workers if there are any shortage of the workers. And we also aim to hire about 3,000 medical doctors going forward who will be mobilized going forward as well. And we will also accept and receive the applications for volunteers who will be helping out with the vaccine rollouts. And third, in order to enhance the convenience of the vaccine rollouts of the citizens, we will have also the call centers who will be taking charge of the reservations of the vaccination, and they will also make sure that they have no discomforts in using the vaccination centers even under storms and heavy rainfall. And going forward, we will also equip designated hospitals with the freezers so that we will also enable the Pfizer vaccines to be rolled out at these facilities going forward. And also, fourthly, we will be having more discretion and authority to the local governments so that they can have more discretion over the vaccine plans. And all of the details will be disclosed in a transparent manner. I believe that this will contribute significantly to enhancing the efficacy and the efficiency of the vaccine inoculations. And the government, as well as the health authorities, will also continue to redouble our efforts until we reach our goal of herd immunity. We ask you to have confidence and trust in the government's plan. We ask for your continued consideration and understanding. Thank you very much. And next we have the Minister of Health, Gov'T, who will be providing up on the details of the COVID-19 vaccination plans going forward. I would like to provide the briefing information on the inoculation plans for May and June going forward. First of all, the supply for the vaccines. In April, we have also agreed to acquire more than 40 million COVID-19 vaccines from Pfizer, and we also have available the doses for about 100 million people. And on top of that, we also have the AstraZeneca vaccines, which will arrive more earlier than scheduled, and we will also have about 18 million doses of the vaccines to be arrived in Korea by the first half. And going forward, starting from May to June, we will have 12.4 million doses of the vaccines going forward, which will arrive here in South Korea. And going forward on a weekly basis, we have the Pfizer vaccine to be arriving here in South Korea. We also have the AstraZeneca vaccine to be arriving here in Korea as well. And with these supply and shipment plans, we will also like to extend and also enable the efficient rollout of the vaccines. And please have trust in the government's plan. And also, if you are scheduled for your eligible recipient of the vaccine, we ask you to get vaccinated as soon as possible. And we also have plans to support the Korean homegrown vaccine development. And amid global competition of the vaccine race, we believe that it is very crucial that our Korean companies have the capacity to develop COVID-19 vaccines. Right now, we have 5 firms which are conducting clinical trials, and by latter half of this year, they aim to have the 3rd clinical trial, and the government will also provide our full-fledged efforts and assistance so that they can provide and go hence with the 3rd trials, and we will also help them out with along with the cooperation with public institutions and research centers going forward. And we will also provide assistance to the application of the targets of and the subjects of the clinical trials. We will also establish a platform of matching services. And here in South Korea, we also have plans to acquire more vaccines, and we will also have the technology transfer as well. We will make sure that the Korea becomes a hub of vaccine development. And also starting from May, we will also have a TF team to look into the development of the raw materials needed for vaccines. And going forward, we will also provide more incentives like a decrease of their financial burden as well. Please note that we are in a very fierce competition globally in terms of COVID-19 vaccine development, and there will be no plans that will also be hindered by here in South Korea, and we will also enhance our vaccination dependence here in South Korea as well. And I myself was also vaccinated of the COVID-19 vaccine. We ask you to have no anxiety, but please get vaccinated if possible. Thank you very much.
예, 지금부터 질의응답 시간을 가지겠습니다. 질의응답은 비대면으로 진행하고 있습니다. 현재 기자분들
That'll conclude our coverage of this briefing. And today, President Moon Jae-in addressed similar issues, brushing off concerns regarding a potential vaccine shortage in South Korea. He said the country will continue to get a steady supply. Chairing a meeting on the government's COVID-19 response, President Moon reassured the public that the country's vaccination program is going according to schedule and that the government aims to inoculate 13 million people by the end of June. Close to 3.5 million people have got their first doses so far.
지금처럼 시기별 백신 도입 물량을 최대한 효과적으로 활용한다면 상반기 1,200만 명 접종 목표를 1,300만 명으로 상향할 수 있을 것이라는 보고도 받았습니다. 5월에도 화이자 백신은 주 단위로 국내에 안정적으로 공급될 것이며 아스트라제네카 백신은 당초 계획보다 더 많은 물량이 앞당겨 들어옵니다.
President Moon also highlighted the potential for South Korea to become a global hub for vaccines, saying the country is second in the world in terms of its capacity to produce biomedicine. He called for cooperation between the government and the private sector and for officials to provide the necessary administrative and diplomatic support. Moon also noted the importance of securing vaccine sovereignty, calling for bold support for local companies with a high potential to succeed in making their own vaccines. A top South Korean official in charge of disease control says, however, that even if the country reaches its goal of vaccinating 70% of its population, the virus is likely here to stay. That's because it protects against the COVID-19 disease, but doesn't necessarily stop people from carrying the virus or infecting each other. It's also not clear how long immunity lasts. Pae-Eun-ji has the details.
South Korea's National Medical Center on Monday released an interim vaccine report showing that neutralizing antibodies had been formed in all those surveyed. Research carried out on 50 of its employees, all of whom were given the Pfizer vaccine, showed that 62% developed neutralizing antibodies 3 weeks after their first dose, and all had antibodies 1 week after the second dose. The National Medical Center also reported that the fatality rate for the past 2 months has fallen to 0.69%. This is almost half when compared to the pandemic as a whole, at 1.49%. It added that 70% of hospital beds for critically ill patients are now available. But the chief of the country's Central Clinical Committee on New Infectious Diseases, Oh Myung-don, says that even after 70% of the population is fully vaccinated, it is unlikely that herd immunity will be achieved. He added in a press briefing on Monday that Pfizer's vaccine efficacy of 95% refers to the prevention of contracting the virus, not the prevention of the virus being spread to other people. He also said that not knowing how long immunity will last is another factor. Meanwhile, South Korea confirmed 488 new COVID-19 cases on Monday, the first time in a week that the number has fallen below 500. But this does not necessarily mean that the spread of the virus is slowing down, as the drop was in part due to fewer tests being done on the weekend. Of Monday's 465 locally transmitted cases, more than 40% of local transmissions were from outside the capital region. This raised concerns among health officials that the virus is spreading all across the country. The government warned that in order to contain the outbreak and to stop variants from spreading, there should be fewer private gatherings in May. Also, for 2 weeks starting Monday, the Education Ministry is trialing testing teams, conducting PCR tests in schools for anyone wishing to receive one. This will be expanded nationwide if the test run proves effective in Seoul. 배은지, Arirang News.
Turning to the economy, South Korea's overall industrial production in the first quarter of this year not only bounced back to where it was before the pandemic, but has risen to a new all-time high. Another sign the economy is getting closer to a full recovery. Kim Sung-min reports.
South Korea's industrial output in the first quarter of this year has hit an all-time high, even surpassing pre-pandemic levels. Statistics Korea said on Monday that the nation's overall industrial production index came at 111.2 for the first 3 months of 2021, up 1.7 from the previous quarter. Industrial production had declined in the first quarter of 2020 to 107.9 due to the pandemic and fell further in the second quarter. But it started picking up again from the third quarter, fully recovering by Q1 this year. The surge was largely driven by improvements in the mining and manufacturing sector, which saw record growth of 113.9, continuing its upward trend for the third quarter in a row. Manufacturing hit its highest level since records began in 1980 on the back of robust exports of chips and automobiles.
The recent industrial output growth has been largely attributed to the global economic recovery, which led to the improvement in exports, especially chips. But in-person consumption continues to drag down the overall growth due to the pandemic.
While the service sector, which was hardest hit by the pandemic, is yet to fully bounce back, it has seen 3 consecutive quarters of growth. Retail sales, a barometer for consumer demand, have been steadily growing over the past 2 quarters, and facility investment has been on the rise for the last 4 quarters. While there's a clear trend showing economic recovery, the government remains cautious amid concerns over the recent resurgence of the pandemic. Kim Sung-min, Arirang News.
And South Korean stocks were down today as a ban on short selling was partially lifted. The benchmark Kospi was down 0.2% to close at just over 31.27. The Kosdaq plunged 2.2% to under 962. The short selling ban was lifted on shares of firms on the Kospi 200 and the Kosdaq 150. The ban was put in place at the start of the pandemic last March to prevent what some feared would have been an exacerbation of the market crash. Short selling is when investors sell stocks they've borrowed, betting that the stock price will go down, then they pocket the difference when they give back the borrowed shares. Time now for an in-depth look at the market news this afternoon, and for that I'm joined on the line by Dr. Yang Jun-seok, Professor of Economics at the Catholic University of Korea. Professor Yang, thank you for coming on today.
Happy to be here.
Well, stocks last Friday on Wall Street closed lower despite those strong earnings we saw. Apple was one of those that closed lower despite an outperformance on its earnings. The Dow was off 0.5%, the Nasdaq by about 0.8%. Tell us about that and what you see in the week ahead.
Okay, well, the U.S. market last week was an up and down week. It did go down on Friday, but it actually went up quite a bit on earlier parts of the week. And throughout the week, the U.S. indices actually hit or came near record numbers. NASDAQ had a record closing on Monday. S&P had a record closing on Thursday, and Dow ended Thursday near its record closing. So the lower numbers on Friday, it may represent some profit taking. It also may have some concerns about the end of the pandemic. While the earnings reports were very good, as you mentioned, about half of the S&P firms have reported their earnings for the first quarter, and more than 85% beat the expectations. And tech companies' earnings are very high, but they may be showing a bit of a peak. The number of Twitter users, the number of Netflix subscriptions, they seem to be peaking, so that there might be some concerns about the end of the pandemic. When we can stop distancing, it means that people may use less technical support, less internet than they did before, so slower growth possibly for the tech firms. And then the central banks may start tapering, and there's also inflation worries. So those may be feeding into some of these stock price changes. And also, China's economy may be a bit weaker. Their purchasing managers index numbers came in a little lower than it did last quarter. And EU and Japan is expected to have continuing negative growth. They had negative growth for the first quarter, and for the beginning of the second quarter, probably negative growth as well. The EU, it was down latter part of the last week for DAX and CAC. FTSE was about level, but they're all up today about 0.1 to 0.4%. Asian markets, Nikkei, Shanghai, and Hang Seng, they're all down today about minus 0.8 to minus 1.3%.
Well, Korean stocks were down today, too. The big story is that short selling is partially allowed again. Some say, though, the risk of that for the market is overblown. Tell us about the Korean market and what you make of that issue.
Okay, well, we may be over-concerned about short selling because we saw in, say, GameStop in the United States where individual investors ganged up to raise the price of the stocks that the funds were short selling on. So they caused short sellers to actually lose money, and that type of I'm not sure if you could call it market manipulation, but that type of tricks that you can do with short selling has concerned a lot of people. When you introduce short selling, you are introducing somewhat of an element, more element of risk. But fundamentally, short selling cannot go against the market for an extended period of time, and especially in Korea, you cannot do so-called naked short selling because, well, you have to borrow the stocks that you want to sell first. So it's unlikely that short selling will be large enough to affect the market as a whole, though it may affect prices of individual stocks. But for KOSPI and KOSDAQ in particular, KOSPI especially, I don't think had much to do with short selling because the market went up. The index went up for the morning. It only fell in the afternoon. So if people were afraid of too much short selling to begin with, then we would have seen the drop earlier in the day. On the other hand, KOSDAQ, it did go down all day, and it lost about 2.2% of its value because they're so filled with tech companies, and there are concerns that tech companies are especially overpriced. They may be more scared of short selling there.
Well, now also from next year, the Korean government will be levying capital gains taxes on cryptocurrency gains, rather, for better or worse. There'll inevitably be some issues to work out there. If you could, Professor, talk a bit about what those issues might be and what you make of the situation.
Okay, well, cryptocurrency was originally designed to be currency, something that we buy and sell stuff with. But because the values have fluctuated so much, it's not really used as currency at all. People are really reluctant to use cryptocurrency to buy and sell for purchasing goods and services. Rather, they buy and sell to gain value, just like stocks or bonds or gold. So it's most countries are now classifying cryptocurrency as assets or other investment goods rather than currency. And as I mentioned, the price is very volatile. The reason is that when we theoretically think of a price, you have a fundamental component and expectation or bubble component. Fundamental component for stocks is what is the underlying value of the company. Fundamental value for bonds, it's how much the bond is worth at maturity. How much money will you get back? But cryptocurrency right now has no fundamental component because it's not linked to anything in the real economy, so it only has the expectation, the bubble component. So when people think that the price of these cryptocurrencies are going to go up, when there's wide expectation that it will go up, the price goes up very quickly and very high. When people think that it's going to go low, it drops very quickly and goes very low. So it's a very dangerous type of investment. And in addition, while other countries have introduced taxes on cryptocurrency in the last 5 years, Korea hasn't. So not only you get a large profit if the price goes up, you get to have that profit without any taxes. That accounts for a lot of so-called kimchi premium, why people prefer to invest and why price for cryptocurrency in Korea is higher than some other countries. So it's not really a level playing ground. And by not having taxes, you're implicitly encouraging people to invest in cryptocurrencies, which again is very highly dangerous. So in order to get sort of equalized the playing ground, you should introduce taxes. So you may argue about how much taxes, but still, they should be roughly equivalent to other type of investments. And you should warn people that this is a dangerous investment. There should be a measure of transparency when people buy these cryptocurrencies. These people who sell them in exchanges have to warn that this is a dangerous investment. And for consumer protection, where the government may pay you if the price of cryptocurrency drops too much, like we saw sometimes in some type of stock investments or bond investments, that should never happen with a cryptocurrency, because in that case you will set up too much of a moral hazard. If you take a loss in these highly dangerous investments, government pays all or part of the loss, but if you gain, you get all of the gain. That is not something that you should encourage in an asset market.
Indeed, and it should be noted that with other regulations coming into effect, the tax authorities in Korea will have a very good idea of who has what on what exchanges by the time the taxes take effect. Well, Professor, we'll have to leave it there for today. Thanks so much for sharing your insights with us. We appreciate it.
Thank you.
And that brings us to the end of this newscast. Thank you for watching. More live news coming your way at 7 p.m. Korea time.